Today is a very special video. One of my very favorite colleagues, Dr. Sandeep. Dr. Sandeep is currently working as a registrar in Wollongong, Shellharbour and Nowra Hospitals in internal medicine. His journey has been interesting. Thank you for joining.
Thank you for inviting me into your show. My name is Dr. Sandeep Kumar. I'm currently working as advanced trainee in Wollongong Hospital.
Mhm.
I just finished my training. I completed my specialist pathway peer review and waiting for the job. We came to Australia in 2022 February, and I was roaming around in Sydney. And then my wife said, "Oh, you have to work." I said, "Okay." And then I didn't have any idea about specialist pathway. We decided to go through standard pathway, and I booked my exam. I remember in March, I gave in April, I passed. That's the most relaxing thing that, okay, I have something to do now,
Yeah.
but the task continues and you have to go through interviews. I think I have given almost 30, 40 interviews. I got selected in almost every interview.
Mhm.
And then comes the hardest part after a registration. So
That's
after registration was hectic. And then I started as a IC registrar, as internal medicine unaccredited registrar,
yeah, yeah.
and then applied for a specialist pathway and entered into advanced training. And now I'm waiting for a consultant job.
Wonderful. So let's break it down. I think there's a lot of information for the to catch up on. So I'll start from the very beginning. Let's go back to India. Tell me, where do you come from in India? Where did you graduate? When did you graduate? And what experience, clinical experience that is, did you have in India? And you've done some specialist qualification. Tell me more about that.
I come from a place called Lucknow in India, which is in Uttar Pradesh. I did my undergraduate from one of the prestigious college, which is called King George Medical University. In 2006, I graduated in 2011, done my internship in 2012 in Grant Medical College, Mumbai, where I did my MD for 3 years, and then I was lecturer there for 1.5 years. And then I decided to enter into private practice. And after that, I worked for 4 years, almost 4 years in Mumbai.
All right, wonderful. That must have been some real good experience working in Mumbai as a consultant. I presume it's got to be more busy than Australia.
It was hectic because here I think 20 patients admission in a day, they called it hectic.
Yes.
In India, it's like average is 100, and they don't say it's hectic. So in Mumbai, like that, when it's a peak time, I difference I have found here more focus on quality. Even in India, because number of people are more, we are a lot of people, but never compromise on quality. But sometimes, like number of doctors in India, huge numbers of patients,
Mm.
so we miss things. So yeah.
Fair enough. So let's now fast forward after your MD training and obviously your consultant experience in Mumbai, very busy. You must have been getting tired of that monotonous, very busy life. What inspired you to take up AMC as opposed to specialist pathway? Because you were already working as a specialist in India. About the AMC, why not the specialist pathway to begin with?
My wife was planning to come to Australia. She has already gone through all procedures, and then she told me that, oh, I got a seat in University of Sydney, and then we have to go there. And then I just resigned. I didn't have any option. I prepared for only 1 month and gave. Luckily, I passed.
So you've done the AMC and now you're in a job market. So in a job market, you're coming in a very polished candidate. And that, what year is it now? 2022, is it?
2022. Yeah.
It's still peak time, Australian market, lots of jobs being given out to IMGs because COVID is just coming off and there's a huge demand in the hospital. So you've got 4 years of consultant experience. Prior to that, you've done MD internal medicine and obviously you've done AMC one as well. How did you find the process of job applications and interview? You said that you were pretty much shortlisted for every job, which goes on showing that that was the peak time of recruitment. Like, can you just think of what time it was like when you started to apply for job? Was it like the typical
So
recruitment campaign, or was it towards perhaps the later part of the year?
I passed in April. I started applying in May. I got my first interview 31st of May.
All right, pretty much like a first round of recruitment, April, May.
Yeah.
And
And
that's the first job that you got. You accepted that job?
yeah. First job I accepted. I got a job in medicine, but my first job was as a ICU registrar in Australia. Yeah, because of my experience in ICU, because I was handling ICU as well. So
Yes.
they are happy to take me as a ICU registrar level 2.
And which hospital was that, Dr. Sandeep?
It was Bathurst, near to Sydney.
Oh yes, Bathurst. And how did you find that job? Coming from, working in a private practice as an internal medicine consultant. Obviously, you had some ICU experience, but how do you find working in Bathurst?
I believe it's challenging. It's regional. It was challenging because of understaff. So that was my experience in ICU. I joined in November. I worked straight for 25 days, 12-hour shift.
So that was your first job. So how long did that last? You joined that in
Three.
May or?
No, no, no. So that's why I said AFRA was 4 months. I got my job in July, applied for AFRA. It took 4 months. My AFRA came at the end of October. I joined from the 1st of November. But Bathurst was challenging.
And where did you go afterwards after doing the ICU job? You
Yeah,
moved.
why I changed it. One is it was hectic for me, and other thing was there was no WBA,
Mm.
and I was not getting any chance to prepare for MC2. So I spoke to a few people and they said you have to give interviews because you're trained in medicine. So it's better to work in medicine if you're thinking of a specialist pathway. And then I started searching about specialist pathway. And then I thought before applying to specialist pathway, I should work as registrar in medicine. And luckily I got a job in Tari where there was WBA program as well. So I went there to work as an
That was in
unaccredited.
medicine, right?
Sorry.
That was in medicine.
Yeah, yeah, unaccredited registrar in medicine. Yeah.
So that is more like your home ground, your home turf. You're kind of used to things. But was the staffing a bit challenging there as well in Tari?
No, it was much better. People from John Hunter come there, and it was
Much supportive there. Okay. And what was the work like? Can you just take me through your schedule in Tari as a medical registrar? Because lots of people who are coming in for a special pathway or even coming as a registrar, what should they expect at work in terms of the clinical responsibilities, any teaching responsibilities? Just briefly, can you tell me?
especially for Tari, I will tell you, or any regional hospital. These regional hospitals are attached to the bigger hospitals like John Hunter, which is a tertiary care hospital,
Mhm.
from where BPTs are rotated in regional hospitals. So you're getting support from the BPTs, and they hire unaccredited registrars as well. But as compared to the bigger hospitals, you have less number of registrars. So you have to manage after hour shifts or evening shifts with all 5 or 6 registrars, and then the weekend shifts. For me, I took almost every alternate Sunday. I worked, I think, twice a week, evening shift. So they are very happy.
That's way. So basically, you're saying that it was well staffed, you enjoyed your work there compared to your work previously in Bathurst. You found it a bit more doable because it was your own specialty plus the working hours a bit more civil.
Mhm.
Now, at the same time, you're now thinking, or maybe you're applying for the specialist pathway. Let's talk a little bit more about that specialist pathway. Tell me, how did you come to know about the specialist pathway, RACP, General Medicine Specialist Pathway, and how did you find the process of application?
So because if you clear AMC1, then next step is job, then next step is AMC2, WBA, or what should I do? So when you try to search for everything, so
Yeah.
you find this pathway, standard pathway, competent pathway, specialist pathway. Then you search on internet. I saw your videos. I saw so many pages on Facebook.
Mhm.
Then the hardest part when you're IMG is your evaluation. You have already worked for last almost 10 years, and then someone is saying you're doing good or you're not doing good. So I wanted to do, then I found there's a specialist pathway as well. The best thing was my wife was pregnant. I was very prepared. My CV we started in June or early May.
Mhm.
It took me 2.5 months. I struggle because no one replies on internet. People don't share their information. The biggest challenge is what to write and what not to write. If I'm general medicine, I will work in ICU. I can do this thing.
Yeah.
And then
Imagine
that
if you get
hampers.
into central labs.
Yeah, we have shifted our focus from internal medicine to ICU. So we don't know what to write, what not. I have written ICU a lot in my CV. And then I realized I don't have to write. And then I tell everyone, if you have done cardiology, you just write about cardiology. If you've done nephrology, just write about nephrology. You don't have to show anything else.
Yeah.
I think, and when I applied in August, I got interview call. My interview was, I think, in last week of August, and my result came in first or second week of September.
Mhm.
I gave, I think, 4 or 5 interviews. I got selected in all of them, and I joined Wollongong in November 2023.
Wow.
So within starting of 1 year, I got selected in a specialist pathway.
Wonderful. Wonderful. So that is, I might just pick you on that one. because there's a lot of confusion around, and I think most of it is quite genuine, and fears that, look, even though you may end up having a partial comparability or substantial comparability even in fields like cardiology or gastroenterology, general medicine as your specialty, but the job situation now in 2025 compared to what it was is quite challenging to get that top up training, which includes, your top up training followed by a peer review. From the job point of view, what do you find is the situation now?
I think I will tell you about after you getting a comparability. I think when you're onshore, chances of getting job is more. When you're offshore, first they prefer people who are onshore because a lot of paperwork, immigration process, and it's delayed by 6 months, 12 months. I have seen people who have applied in, who got a job in February, they have not still joined the hospital. So if you're not getting job, I believe for standard pathway, do AMC1, come here, get to the system. I think people should, if they are not getting job, don't hesitate, just come work for 1 year or 2 year, and then I think the hospital you're working, they will prefer you if you're good.
Lots of people now, we have seen, like yesterday, you may have seen the email from our cardiologist who
Yeah,
manages Rockhampton Hospital, and then there's other general medical and regional medicine. So things are kind of unpredictable at times as well. I've had a nephrologist who have managed to get a job, quite a few internal medicine registrar who were having multiple job offers from various regional hospitals. We've had pediatricians being given a job. We have had obstetrics and gynecologists given a job. So, how much do you think it is dependent on your previous clinical experience? Because most of people are coming through specialist pathway, but the experience and the way you conduct and you present yourself, do you think it's important or not really important?
yes. I do think it matter because if you're so good on paper and if you can't present during the interview, you will never get selected. The other thing I want to mention, I think the specialist designed for regional places, not people who are working overseas. They think that, oh, I will go to Sydney. I think it's impossible to get a job in cities. People who are not trained here should work in regional first, get trained, understand the system, and then come to the cities. The mindset that, oh, I will work only in city, then you will rare to get a job.
Moving on, what about the interview process of RACP for specialist assessment? How did you find that?
So you have to tell your story.
Mm.
To tell your story, you should be prepared. It's intimidating because you're giving interviews in Australia, and for specialist pathway, you have spent thousands of dollars. If you're stressed, anxious, you will ruin your interview. So
Are they quite intimidating during the interview?
no, they're nice. It's we anticipate.
Because when I'm preparing people for the interviews for the specialist college, I said that, look, first thing you've got to understand, it's a discussion between the colleagues. You're all consultant.
Yeah,
It's not, they're critiquing you or they're judging you for your training. It's just they're comparing you to the standards of an Australian trained specialist.
yeah,
And pretty much for most people coming from Pakistan and India, it is, if the years match up, you'll be substantial. If the experience matches up, it'll be substantial, if not partial. And I think RACP are actually quite fair in terms of general medicine, cardiology. We've had substantial comparability with gastroenterology without interviews because of MD and DM. So I think that you're right. The overall process is more intimidating sounding because
yeah,
you don't know what's going to happen. It's the
yeah,
fear of the unknown, right?
yeah.
But if you're well prepared and well rehearsed, then it is not. So what kind of questions would someone expect in an interview?
Don't miss this point because whatever I have done mistake during my preparation, I don't want them to do the same thing. I think you have to sell yourself, so you have to sell yourself that I'm, as good as an Australian practitioner. So I'm compared. So they normally what they want to compare is your internship is comparable to Australian health system. Your BPT or basic physician training is comparable to our Indian, Bangladeshi or Pakistan FCPS system. And then if you have done super specialization, they will say, okay, if you're a cardiologist, have you done these procedures? Have you seen this number of patients? And just if you have been trained for 3 years. So overall, if anyone who's trained for 6 years, mostly they will get comparability. That's my assessment. On top of that, if you're doing SRship or consultant, that will add more points. But I think they just want to see whether you're trained for 6 years or not. And the problem comes in general medicine.
Yeah.
Because in India, general medicine is 3 years, but in Australia, general medicine is 3 years plus 3 years, total of 6 years. That's why people from India get difficulty in getting compatibility because in India it's like I have done 3 years now I will do private practice.
Yeah, that's right. But that's who you were the one who told me that look, senior resident experience in India, it's so important because we've got the same kind of problem in Pakistan. The FCPS training program is 4 years. So in order to compare that standard to the standard back home, you have to have 3 years of MD training plus 3 years of a senior resident training, or at least 2 years of senior resident and then the remaining consultant. Because I think in RACP application, they're actually quite reasonable. They can use some of your consultant experience to compensate for that lack of training. And India, there's the grades that you go through, like you can utilize senior resident experience and assistant professor. They're quite interchangeable
Yeah.
because you would be working as a junior consultant, you'd be under the supervision of someone senior, and you can utilize some of those qualifications and experiences to compensate for that duration of time in terms of 3 years versus 6 years here in Australia.
And I will add one more point because we have gone through so many assessment forms. People after MD medicine do 1 year of cardiology, then 1 year of neurology, and then they apply for RACP, and then they are not getting compatibility. If you are MD medicine, do in medicine. Don't do any SR post in any department or ICU. Just show it's medicine rather than showing any other departments. People are not getting compatibility.
It would be like more like you're diluting your experience, right?
Yeah, yeah.
Absolutely. So, fast forward, you've done the interview. How did you find the process of finding the job in Wollongong Hospital after the specialist comparability assessment? You would have been favorable to Wollongong anyway because you had done the ICU job in Bathurst, you have done an unaccredited registrar position in Tari near John
Yeah.
Hunter. So it's a pretty good CV now looking, and plus you're on shore now. So for you, this job was like meant to be. What would be your recommendations for someone looking for a job after specialist comparability assessment? You said something about being on shore. You said doing an AMC, which is, I guess, that defeats the purpose of coming on the specialist pathway anyway. But if you are struggling, maybe this is something to consider. I do advise that, like you're struggling for about 1 year and you're not getting anywhere and not even getting shortlisted, then maybe AMC one would be the way to go. And we've even seen some cardiologists having done AMC one, increase their chances to come as a medical registrar. But overall, what would your advice be in terms of getting the job after the specialist comparability assessment?
I think now there's more competition. People are applying for dual train. Suppose someone is rheumatology, they also advise applying for general medicine as
You
well.
mean the local trainee because the competition is
Yeah.
so.
So
So now they're applying for dual
yeah,
subspecialization, rheumatology and general medicine because there are more jobs in general medicine and geriatrics.
yeah. And the problem I have seen in Australia is even you're trained in general medicine, or if you're a specialist in general medicine, but the seat goes to nephrologists who's dual trained or cardiologists who's dual trained. I think the job market is good for general medicine, but people are who are especially trained in general medicine are getting harder to get a job in general medicine. So it is becoming more competitive in terms of getting a job in general medicine as a consultant, not as a registrar. As an advanced trainee, it's still easy to get a job, but you have to prepare yourself. If you go to the interview and you don't know what you, I think there's a communication gap where people don't understand what they're asking
Mm.
because overseas, I for example, they say, okay, so numb. People don't know what is numb. They are confused. And because of hesitation, they don't ask what is numb. And so people don't know the terms here. So I think working here gives you a benefit, how system works, what protocol we follow. Every district has a different protocol. So if you work here, these are the protocols. Even in clinical question, they ask if you tell as per Australian health system, they prefer you. The other things are ethical question. If you're overseas, you don't know what are the ethical question, how you solve. I have learned during my unaccredited training, and then you will become more confident in giving answers and how to. I think because people make their CVs only once and they apply for every job, I think it should be changed according to the job responsibility of what they are asking for. So this is the main. If you have the qualification, you're not getting even interview calls because you're not modifying your CV.
And people don't often understand there's a lot of geriatric patients here.
Yeah.
And with the geriatric, more than two-thirds of the patients are geriatric patients. So with geriatrics comes a different set of challenges. These things become very important when you're being interviewed, especially in the clinical scenario. And if you're not using those words logically, you've heard about these things, but you don't know what they mean.
Yeah.
So you're right about it. Okay, so moving on. Now you've completed your specialist pathway assessment. Congratulations. You've
Thank
got a
you.
permanent residency already, or it's in the works?
It's in the works.
Very soon.
Very soon.
But
Yeah.
you're on specialist register, right?
Yeah.
You're very successful. You're one of the first few ones in Australia. You're the first one in terms of general medicine. No exams. You've completed all the requirements. And you told me that your process went very good. Your supervisors were quite happy with that,
Yeah. And
which is excellent.
yeah.
So, how do you find the process of finding the job now as a specialist? Like, can you work now privately? Do you need to apply for a job? How are you finding the process?
Yes, I think it's competitive. Everything is staged. People are struggling with AMC one and then WBA, then advanced training and then job. Now I'm in phase. So I'm waiting for a ride. I have applied for so many jobs, waiting for interview to come.
That's right. Yeah, and you're not the only one. I remembered when I finished my emergency medicine training at St. George Hospital as an emergency medicine consultant in a public hospital. It took me long time, almost 5 years. So I was working as a locum VMO, and it does take time. And now the fresh graduates of training programs who are coming out, like any training program, emergency medicine, physicians, surgeons even, they are going through the same struggles. They have to apply for a job, they have to build their own customer base, they have to start doing locums in the regional and sometimes even rural area. I remember this one cardiologist, Sandeep, who was cardiology. He's got a very established private practice in Sydney in cardiology.
Yeah.
Yet you have got these new cardiologists coming into the system. They've got no work immediately, and they're trying to build their name, and they're doing these general medicine locums. And I think the struggle, this is the final phase of the struggle. Trust me, once you get the job, everything is going to be on automatic. You don't have to worry about the renewal of your registration and finding a new job. So, what about the locums? Is the locum market, can you do locums in general medicine as a registrar or as a senior doctor or even as a consultant? Probably might be a good idea to do 3 months locums or at least a month locum.
Yeah, I think because I'm overseas now, I'm not trained here as a basic physician trainee. Or I'm applying for a job as a consultant, and someone is there who's have 5 years of experience or 6 years of experience. They will prefer them. There is locum work.
I also feel, Sandeep, that your position is a lot better than someone else who's coming into the system starting freshly. After permanent residency, I think things would further improve because in Australia, they tend to prefer the permanent residents first.
Yeah. So this is the challenge for me as well because because I have applied in cities are rejected because I don't have PR.
Yes, yes. So I have PR. It shouldn't take too long. Did you end up doing the WP program? Because if you would have done the WP program, you would have had the PR.
I was about to start, so I said no, I can't do WBA now.
Oh, okay. All right. Well, I mean, I think everything happens for a reason. At least you got onto the specialist pathway. You did those components of specialist pathway, which are equally important. Lastly, I would like to touch base on very important question and Middle East as well. And one of the things is always interesting for me that why they want to move is for the work-life balance and for the reasons of better salary. What do you think is the life like here? I mean, you're quite bit recent compared to myself. I came here about 20 years ago. So you would know how things are in India, or people coming from Pakistan would know how things are in Pakistan. Obviously, things are not great. That's why they're looking for new horizon. But what has been on the personal level, the life been for you and your family in Australia after coming over here? I mean, you've been here for how long now? 3 years?
I will finish 4 year in February. So I came in 2022, so 4 years. But in clinical practice, 3 years. Yes, there's a major difference. The first thing is, I believe, is age factor. In India, it's competition. Or in our country, it's competition. So everything should be, you finish your 12th grade at 17, join med school within 1 or 2 years. Everything should finish in time and you become consultant by 28. Here, I saw interns, med student at 50. Age is not a factor here. So that's a good thing. You feel much more relaxed that, oh, I'm a registrar at 40, 35, no problem. And the other thing I believe is the timing. You get a lot of time for your family.
Mhm.
No one calls me after 4:30. No one calls me from the hospital. That was best thing in my life because working as a consultant, I was alternate day on call for 4 years. So for anything, I will get a call. Even I can't go for dinner.
Because today I open up my inboxes. There were like about 30 messages and emails, probably about 80 emails. So I try to sound like a broken record when I try to say and highlight the same thing over and over again. But what would your advice be, having done the process yourself?
I think patience is the key. People should be patient. If you're not getting a job once or twice, people become hyper that, oh, I'm not getting a job. And if you're getting a job, accept it rather than waiting for, oh, I will get a job in Brisbane or somewhere else. If you're getting a regional area, just accept it. Once you're here, you know uh, you are in a better position. I think you will have more options when you come to Australia, rather than sitting and hoping for the best. That opportunities are less because in Australia, I think they are in especially apart from general medicine, they prefer trainees who are trained from here rather than from overseas. So I think overseas is the last option. So that's why I think just apply. Just apply. One day it will change.
Yes.
Will
And
change.
well, I think that's a very good idea and very good message. Take home that be persistent, be patient, keep on with the strict discipline of job applications. And one day, when you get that first job, don't think about anything else, make a move, come over here, and then you can always tweak and think about the next job in more favorable city, region, whatever. Thank you very much, Dr. Sandeep. It was excellent. And I wish you all the best in your future endeavors. I think you're not far away from your consultant position. So hold on tight on your advice, that point is. And I'll meet you at the hospital very soon.
Thank you. Thank you for having me in the show. Thank you so much.